This is Annie, and I'm the Disability Inclusive Development Program Coordinator for Humanity and Inclusion, and I'll be the chair for this session. On behalf of the Inclusive Futures Consortium, I'm very pleased to welcome you all to our webinar on finding and enrolling children with disabilities in school. This is the first of our lunchtime web series on inclusive education, and today's webinar will be in English. We have simultaneous translation available in Bengali. Unfortunately, our Nepali translation, there are some issues. We're trying to work on that. To choose your language channel in Zoom, please click interpretation button and click on the language you would like to hear. If you would like to hear the interpreted language only, then click mute original audio. You can also look at closed captions, which is available during the webinar. And to view captions in Zoom, click the closed caption button and then select show subtitles. We have the International Sign Language that will be pinned to the screen throughout the webinar. Please note that the webinar will be recorded and shared afterwards. You can use the chat function to make any comments, and please feel free to use the Q&A box if you would like to raise a question to our panel. Moving on, about Inclusive Futures. Inclusive Futures is an 8-year consortium program that supports the FCDO Disability Inclusion Rights Strategy in 6 countries in Africa and Asia. The program generates evidence, research, and learning on what works for people to include people with disabilities in global development and in humanitarian response. It innovates and scales disability inclusive development approaches in health, education, livelihood, and tackles negative stereotyping and discrimination through strong partnerships with organizations of persons with disabilities, with local and national governments, with NGOs, private sector, and research institutions. Today's webinar is a part of the learning series, as I just mentioned, on inclusive education, and we will focus on finding and enrolling children with disabilities in schools. The second webinar will be on preparing schools to welcome children with disabilities, and the third and the last one is on centering children with disabilities in teaching. I will definitely share the details at the end of today's event, and we would love to have your participation in the next webinars as well. What I'd like to do is to first briefly introduce you to the Inclusive Futures report on finding and enrolling children with disabilities in school. We will then move to the panel discussion. We will hear from our panelists, Pramila Neupane and Ian Attfield. The closing remarks will be given by Caroline Pritchard, Deputy Head of the Education Policy and Partnerships Team, Girls Education Department at the UK Foreign Commonwealth and Development Office. So today's webinar aims to draw attention to the 240 million children with disabilities, many of whom remain out of schools. And even when they're in schools, we don't know, they're not accounted for due to the multiple barriers that they face. These barriers range from physical barriers to communication barriers and to more structural barriers that require shift in attitudes, changes in policies, practice. Through our inclusive education projects, we have learned that it's possible to overcome these barriers by building on and strengthening existing outreach and identification systems for out-of-school children to be disability inclusive. And for the purpose of this webinar, we use some program-specific definitions for outreach and identification. So outreach, basically what we mean by that, it refers to all those activities that aim to build relationships or raise awareness with people that help to identify out-of-school children with disabilities. It could be a community event, a house visit, or media campaign. Whereas identification, what we mean by it is finding the children with disabilities who are not enrolled and formally recording their details to be used by schools and other services. So what we have learned, we've developed them into 6 practical actions that anyone involved in planning or delivering education projects can take to help find and enroll children with disabilities in schools. So you'll find the 6 actions are on the screen. Today, because of time constraints, we're not going to go into all 6 in detail. What we will do is we will focus on 3 actions: securing buy-in from the first one being securing buy-in from local leaders, supporting parents and caregivers, strengthening data systems. I would encourage you to read the full report. You can find the link on the screen. We will share it also later with this webinar. And when you see the report, it provides some concrete examples of how these actions can actually work in practice. What are the challenges that we faced? Look at the case studies that we have from Nigeria, from Bangladesh, from Kenya, from Nepal, from Tanzania. I would now like to move on to our panel. I would like to extend a very warm welcome and invite our panelists for today's webinar to share their experiences and insight on inclusive education in Nepal, where Inclusive Futures project has screened over 45,000 children from primary schools in 2 municipalities in Chitwan district and supported over 2,500 children with disabilities in the districts. I welcome Pramila Neupane. Pramila is the founding member and executive director of Autism Care Chitwan Society. This is an OPD. As a professional advocate and the parent of a child with autism, Pramila brings a unique and deeply personal perspective to her work, combining lived experience with grassroots leadership to champion the rights of children with disabilities. Welcome, Pramila. And I also welcome Ian Attfield. Ian Attfield is a senior advisor and education team leader for the British High Commission in Nigeria. He has previously worked with FCDO as an advisor in the UK, South Asia, Zimbabwe, and Tanzania, developing and overseeing education projects and partnerships with governments and other stakeholders. Welcome, Pramila. Welcome, Ian. So, Ian, maybe I put the question to you then. What has been your main takeaway from this learning product?
Yeah, thanks. And yeah, I hope that's trying to switch my fellow panelists' video on didn't cause the audio to go. I hope you can hear me. I've been having a few setup challenges, but it looks like you can, which is great. So I was fortunate enough, just to give a background, that I spent 5 years from 2018 to 23 based in Kathmandu in Nepal, and was able to support both some of the Inclusive Future programs there, but also from the Girls Education Challenge, which is a very large FCDO UK government funded program with a focus both on girls' education, but also on broader marginalised children. So we had a dedicated inclusive education program there that was being implemented with VSO and a number of local partners, including OPDs. I've also been, I think, involved in the closing stages of the SMILE program that's operated here, where I'm currently based in Nigeria, in Kaduna State. And so I mean, across all of those sort of initiatives, I think what's really interesting and really transformational, in my opinion, is where by just engaging through using the Washington Group questions with trained facilitators, engaging communities, school management committees, head teachers, and parents and caregivers, is that there's suddenly a much wider understanding of the, what we mean by disability, and also the fact that usually children both in school with disabilities and children out of school in the community are known to people within the school who aren't currently attending. And that helps to create a sort of movement of a force for change and for inclusion, where overwhelmingly I think people tend to seek then practical, locally driven solutions to get children through the barriers, whether they may be physical or care or sensory impairments that get children into school, and also accessing some of the broader support that they need to meet their needs, both on an individual level but also their educational needs. What was, I think, particularly striking in Nepal to me was that the government had a pre-existing system of additional supports and benefits that individuals could apply for, but that was prior to 2018. There was a system of having to go to a district level administrative hospital or clinic to get a sort of medical certification that one was eligible for these benefits. And due to the constitutional and change in decentralisation of governments, those responsibilities had been pushed down to local government, or Palaka level as it's known in Nepal. But the fact was that those systems hadn't been operationalized, and the small and limited staff awareness within local governments meant that they hadn't really made those transitions. So the Inclusive Future Partners and the other programs that I've mentioned really helped to sort of join the dots by identifying children who needed support, and also linking to the current provision that was made, that was being provided through some of the more specialist schools where education was, semi-segregated or in more sort of negative boarding type accommodation. So overall, the awareness, helping children to realise and their parents to realise the rights of the additional support that they could get through government. There were some cash benefits, there were access to some assistive devices. I think the OPDs, I remember myself going on some trips down to Nepalganj near the Indian border, which were really useful because, there were individual, I think there was a child with a very, very significant vision impairment who was helped for the first time to access Braille devices to get training on Braille. We had the programs that hired outreach volunteers who were trained in Braille and in sign language, and there are a whole host of other ways the OPDs in particular supported to identify the right sort of equipment. There was a lot of materials that could come up easily through India, but there were problems with importing specialist equipment and mobility devices and the like into the country. So really, it was that idea that you can sort of ignite a movement for change around children with disabilities and get them in. I think one of the challenging points that came through the programs, just to sort of switch to where we can do more, is around, I think that in terms of the weighting of children identified with disabilities, there was a much higher weight of children who expressed sort of issues of anxiety, depression, and I think that they were often in school, and these were sort of perhaps silent problems. But I think this was also related to the timing, given the fact that this was the COVID area or the immediate pre-COVID area where a lot of individuals, there was a very tight lockdown in Nepal for a long time, where communities couldn't leave their homes, schools were shut, and a great deal of uncertainty about sort of futures and the impact of COVID. A very significant wave of the disease came through, spread up from more broadly in the region. So I think that sort of being able to distinguish out where basically whole school and whole community approaches to address people's mental health, well-being and psychosocial support versus some of those more specific individualized education plans and support needs that children had. Trying to get that balance right is difficult. I've been speaking for too long, so let me stop there. Thank you.
Thank you. Yeah, we do have a quite a tight kind of a schedule, but really important points. All how kind of a the importance of so many sectors involvement, whether it's individualized or whether it's assistive devices or whether it's mental health. Very, very important. Thank you so much, Ian. Is Pramila back? Are you back? Can you come back and maybe take the question about what were the main takeaway for you?
It is that one step that stood out for me from the learning product is that's the securing buy-in from local leaders. In our experience in Nepal, it is fundamental, and not only for the project success, but also for the long-term ownership of the inclusive education. gaining approval is one thing, but the earning trust and influencing mindset is where the transformation begins. Let me share an example. It is from one of the school, community school in our working area. A father who didn't believe that his daughter had a low vision. His daughter was with a low vision, so he scolded her because he thought that she was putting on glasses only for the fashion, and he broke her glasses too. And it is not the unusual here because it is deeply rooted stigma as well as the unawareness about it. And later, when he found, or the teachers found, that his daughter's academic performance is declining, then the head teacher as well as the local leaders from community development committee, they stepped in and they visited the father, and then they explained the condition of his daughter, as well as so the eye checkup, that's reports. And on the same day, the father visited the hospital, took her to the hospital, and provided her with the new glasses. This example seems a bit simple on the on the surface, but if we go through, or it illustrates that the learning product that is securing buy-in of the local leaders. It means it's beyond the formal content consents or the meeting. If a local leader, along with visits the parents along with the head teacher for the to convince the parents about the disability or the condition of the parents or the children, as well as um, okay, as well as if the leader module inclusive beliefs, inclusive behaviors, it further makes it easier for the community to follow. And in the same way, if the leaders work or speak in a school during the school meeting, it makes the family to open up again, and it also helps to break the stigmas. And as well as the children's uh, are easier to brought in the system with dignity. In the same way, that's why it's it's steps that so I think that this step, the securing buy-in of the local leader, is the most important thing. And we have gone through all this experience that firsthand, that if we cannot earn trust and community ownership, then although it is a well built or well designed investment, have to struggle for the sustain. Thank you.
Thank you, Pramila. What you said is very important in terms of how local leaders and school teachers can actually mobilize parents and help parents kind of overcome the stigma that can prevent a child from going to school. Maybe we will stay with you for the next question as well, Pramila. And if you can just perhaps tell us some examples of how you're already doing those practical steps. Take your time.
Okay, thank you, Annie. Let me start by sharing what we are doing here on the ground. Um, it is it is a part of our outreach and identification effort in Nepal. Our approach has always been rooted with local engagement, working with municipal government, schools, OPDs, as well as families. And from the very beginning, we ensured that children are not only counted, but they are heard, seen, and supported in meaningful ways. For example, we conducted community level meetings as well as home visits led by the OPDs and mobile teachers. And we collaborate with ward offices and local education units to organize inclusive education orientation sessions. Through these actions, we have aimed to build trust and make inclusive education as a community-based process, not just a project intervention. One example that illustrates that our approach is related to support parents or caregivers. In our working area, we met a mother whose child had muscular dystrophy, and at the first meeting she stopped us. She sort of out that, saying that if you talk about my child, I won't meet you again. But it is seen that it is not the unusual, because she had it is the deeply rooted stigma in our society, as well as internalized fear. And however, our team didn't stop, but continues visiting the family empathy with empathy. And we also involved OPD leaders to meet her. And later, the tone, which was just sought out us, but later she told us that if I had known about this project earlier, I would have contacted myself. In this way, we can say that how it is important to genuine support for parents and caregivers. Later, we supported her son with a wheelchair, and it looks like a simple act, but we can find that the son the her son started school again, as well as the mother. She became the active parents in her community or community work. In this way, we can say that um, we sub that's the continuing that it's a main important thing, that how impactful it would be if we genuinely support the parents or caregivers, listen to them, and involve OPDs as well as families. It's about, so I think that it's about building trust, enabling the parents not only as a participant but as a partner in this way, so that enabling them to see their children's life differently in future. In this way, I say that it's the transformation begins here. Thank you.
Thank you, Pramila ji. Moving to you, Ian, would you like to share some examples of how FCDO already aligns its work with the 3 practical steps that were mentioned in the learning product?
Yeah, just coming back online. I mean, I think that we've already within FCDO, I said there's been a tremendous amount of learning, both from obviously the work that was commissioned through Inclusive Futures, but also a whole range of other inclusive education programs, some of which I said were put through the Girls Education Challenge, and also through a lot of the bilateral programs. I think as you may, some of the people on the call may be aware, our funding and our situation is shifting a bit with some of the global trends, but we certainly, you know, very clearly back the call for better data and for the empowerment of organisations of people with disabilities. These statements were made, I think, at the most recent Global Disability Summit that took place in Germany just a couple of months ago. I think that, I mean, as a sort of large, obviously, bilateral development partner, we've got a very wide number of education programs spread across the globe, predominantly in Africa and Asia. And so I think some of the challenges for us is to how to, you know, how much in a sense we operate specific inclusive education programs versus some of the wider engagement that we do across all aspects of education. I think this is most pertinent in our work with refugees and education in emergencies and protracted crisis. Because I think some of those situations with displaced people living, children in communities living in refugee camps, it can be where it can be hardest to make some of those sort of practical steps about supporting children with disabilities, and also doing the teacher training and the various other practical steps that are needed. If there's some specific points on that, because I know I may not have stuck completely to the 3 recommendation areas, but that's I think the general direction that we're going in. Thank you.
Thank you. Thank you, Ian. And maybe I would ask you to stay and just reflect on perhaps how because the Inclusive Futures program has been working very much a lot with organizations of persons with disabilities. So maybe a quick reflection on how FCDO and donors more generally can benefit from working closely with OPDs on inclusive education. And maybe I would request it to be maybe 2 minutes.
Yeah, I'll be very short on that.
Thank you.
I mean, I think some of the practical issues are that, you know, certainly as I found when I was in Nigeria, there's such a wealth of organisations involved of OPDs with umbrella networks of permissions, and obviously some which have quite a specific focus to either specific disabilities or impairments or specific medical conditions, such as Pramila from autism. And so sometimes that sort of, how do you work across these what wider networks and organisations, you know, can itself put some challenges. We do, the UK does provide a more generic support through the Disability Rights Fund, which I think helps also to build the internal capacity of organisations with people with disabilities. I think one of the most compelling things we can do is to actually help OPDs to be organised, to join in with the broader education sector working groups, which are obviously usually led by the Ministry of Education in countries, and also engage at the grassroots level. I certainly thought that some of the most transformational work was done with convincing Palaka local government mayors, deputy mayors who are often the female because of the gender patriarchal norms within the pool, of when it came to the political side to sort of lobby on those sort of social and disability and the broader sort of gender equality issues. But it's by engaging locally with those senior local decision makers that some of the transformational changes can come. Thank you.
Thank you so much, Ian. And I will pose the same question to Pramila. Pramila, according to you, what can FCDO and donors more generally benefit? How can they benefit from working more closely with OPDs on inclusive education? And if you can keep your response to 1 minute, that would be great. Sure.
Yes. Thank you, Annie. I would like to respond to this by focusing the third step, that is strengthening data system, and how OPDs play a crucial role in making the work effective and ethical. In our project, we closely worked with OPDs to support in rollout of WGQ, which already Ian talked about, for identification of children with functional difficulties. OPD member didn't only participated, but they supported in facilitation too. They played an important role in orienting teachers as well as collecting contextual insights and ensuring that the tools are used respectfully. Because OPDs come from the community and most of the people they themselves are the persons with disabilities, they have a deep understanding on the barriers of the children with disabilities face. And but it doesn't end, and they help while we're talking about the data collection. It not only limited with the data collection, but we appreciate them what they are working. It's that ensuring data leads to action. They help analyze and present it to LU, that's local education units, to pursue it to integrate into EMIS. It also further supports in gaining further health services, home health education, and so on. For donors like FCDO, working closely with OPDs is not just the matter of inclusive uh, practice, it is strategic advantages. OPDs bring trust, local credibility, and the deep understanding of the barriers too. They also support to ensure that identification systems truly serve the purpose of long-term inclusion. It further serves that's the so if donors invest in strengthening capacity of OPDs, whether it is data management, advocacy, or community facilitation, it is investing for the sustainability and integrity of the entire system. So we have seen this firsthand and believe that this is one of the strongest argument that donors to collaborate with OPDs. Thank you.
Thank you so much, Pramila. Thank you so much to Ian, both of you for your insights. We will move to the next session of this webinar, and we'll open the floor for questions from the audience. We already have a couple of questions, and I'll pick up the first question from the audience Q&A. I'll come to you first, Ian. The question is, what role do health facilities play in finding and enrolling children with disabilities in school? Ian?
Okay, well, that's quite a country-specific type of question. I mean, I think the ideal situation is where there is close integration between health clinics that are giving care to children in their first years of life. I mean, a practical issue is I think that while some disabilities and impairments are very obvious from birth, some which are less visible, you know, certainly on hearing, on behavioural, and some of those sort of spectrum cognitive impairments like, you know, autism aren't immediately obvious. But I think so what ideally would happen is that there is close linkages between local health clinic staff, outreach workers, parents, and schools as children enrol. We all know that the earlier children's disabilities and needs are identified early, ideally when they enter kindergarten or pre-primary school, but unfortunately that isn't available, in particular in more disadvantaged groups in some rural areas of Nepal. But that's where you get the benefits of being able to identify needs early and try to do some of those early years interventions that can make real real transformational change for children, so that they can actually start to learn effectively. Obviously, in some cases, there are to identify medical interventions or specialist equipment that might be needed, and then the question obviously is how those things funded. But that's where Nepal's transition from a predominantly district-based management to local government palika management has been awkward.
Thanks, Ian. I think that's really important, the role that health facilities play and the challenges in challenges with early identification and enrolling. Pramila, the next question maybe I'll put to you. We have a question that asks, how can OPDs and municipalities work together to ensure inclusive education for children with disabilities is delivered sustainably? Pramila?
Yes, and yeah, we know that project is established for a few years or for short times, and the all the activities to be completed or continue or sustained by the OPDs as well as the government. So it is very crucial role of OPDs and government to work together to sustain the activities of all the activities. And nothing about, and the most important thing about OPDs is nothing about us without us. It means while we are talking about the disability, then there must OPD must be included here, and they must be included as a partners, not only as a participants. And we know the issues that so OPDs should be played involved as an important role here, and must go or work together with the municipality for the sustainability of the activities.
Thank you. Thank you, Pramila. And now that we've come to almost the end of our time, we have the final session, which is about which I would like to give the floor to Caroline Pritchard. She's the Deputy Head of Education for Policy and Partnerships team from the Girls Education Department at FCDO, to give her closing remarks. Caroline is a former secondary school teacher. She taught in schools in London, Tanzania, and India. She then worked on education policy in prisons in the Department of Education before joining the diplomatic service. At FCDO, she has worked on issues ranging from climate change to EU policy and relations with Gulf states. She served in Afghanistan at the UK mission to the UN in New York and Mexico. Over to you, Caroline, and I'm sorry for this short putting you on a spot here.
That's absolutely fine. Thank you. And hi, everyone. It's great to be here. So I just wanted to build on what Ian has been saying. As he mentioned, the FCDO already does a lot on disability inclusive education. And looking forward, as he also mentioned, we are in uncertain times. Unfortunately, regrettably, like other donors, there will be some cuts, but we will continue to drive progress on education through innovative financing, through working with partner governments. This will remain an important area for us. And as we look specifically at disability inclusive education, everything that we do going forward, it will be guided by the 4 commitments that we made at the Global Disability Summit in Berlin. And those, I'll be very brief, but those commitments were firstly to ensure that all of our education programming, so that means our bilateral programs and our centrally managed programs, is disability inclusive and includes disability inclusion criteria and targets by 2030. As I mentioned, we think a lot of them already do, but the ambition is that they will all be disability inclusive by 2030. I plan to say more on that, but in the interest of time, I'll go on to the second commitment. The second commitment which we made, again, which we've started work on this, is that we will collect and use disability disaggregated data in all of our programs by 2030. We need to know how many children with disabilities our programming is reaching. As you probably all know, this is not straightforward. It's more complicated than it sounds. So we have a dedicated staff member who is going to be working on this, who's created an action plan. And our intention is that all of our education programs by 2030 will be collecting and using disability disaggregated data. Thirdly, we've got a focus on children in emergency and crisis settings because a disproportionate number of children in those contexts have disabilities. So we'll be supporting stakeholders in this area to adopt the twin track programmatic approach to inclusive education and to strengthen the data evidence and accountability for inclusive education. And then our last commitment builds on the fact that we're not just a donor organisation, we're a political actor. So we have a network of posts across the world. We have missions to the UN in Geneva, in Paris, in New York, and we have committed to using our political weight, particularly at this challenging and difficult time, to make sure that children with disabilities are always included in education debates so that this issue reaches the highest political level. We're going to work with other actors like Norway, like UNICEF, other players to make sure that every time there is a discussion in international fora on education, children with disabilities will be mentioned, will be prioritised. We will be doing some specific things, for example, hosting a Wilton Park conference in the UK at the beginning of next year to bring experts from across the globe to talk about the research agenda. And there's some other things that we've got planned in the coming year, which they're not to do with programming in country, but it's about ensuring that this issue gets the profile that it deserves and that it needs, and using our influence and our diplomatic kind of prowess as the UK government to make sure that this issue is high on the education agenda. That's it in a nutshell.
Thank you so much, Caroline, for the commitments. They're very, very inspiring. And I think it's quite aspirational as well. Thank you so much. Maybe with this, I would like to thank all our panelists, Pramila, Ian, Caroline, thank you. To the accessibility partners, our language interpreters, thank you to all our audiences for listening in. And with this, we come to the end of today's webinar. We apologize for some of the issues that we've had, and we would still look forward to you joining us on our next webinars, which is on 5th of June and 17th of July. Till then, thank you and goodbye.